Everybody, welcome to the CoronaSphere Lounge. I'm your host, Bill Whittle. There was a show at the planetarium when I was working there. Usually we had shows that were done by Jack Horkheimer, but every now and then we would get something, rarely get something packaged by somebody else. And there was this one show called The Legacy, and since it was relatively short, they ran it every hour instead of every hour and a half, and that meant that during the course of a day, I would have to write 11 or have to perform 11 or 12 of those, and we were trying to think of a show for what we would call that nightmare. And so we called it the lethargy, and that's kind of how I'm feeling right now. I am barely here. I don't think it's a question of boredom. It's just, it's just barely here. So I think the back side of this curve is going to be worse than the front side in terms of the mic is up all the way. That's all there is. So that's it. It's just just going to be the back side of this curve, and it looks like we're on the back side of the curve. The numbers are going down. That all looks good. And the hardest part is going to be the second side of this curve. When it was starting, it was, different and exciting and dangerous and challenging and all the rest of it. Now it's just past. It's not a question of boredom. It's just a question of just lethargy, just, yeah. All right, great. Another day to do nothing. And yeah. Well, anyway, the thing I just wanted to talk about briefly today, mostly just to get the entry in, is something I've been seeing a lot lately about the numbers being low, and since the numbers are lower than we thought they would be, there was never any need for the for the home, quarantine and social distancing and all the rest. And the problem is going to be nobody's ever going to really know. There's no way to run a control. There's no way to know what would have happened if we hadn't done anything. There's no way to tell whether these numbers are lower because we did the right thing or whether they're lower because it was not as serious as we thought, but it's beginning to look like we are getting through the worst of it. I know today's being recorded on the 11th. The 9th of April was supposed to have been New York's worst day. It looks like they turned the corner a little bit earlier than that, but the one thing that everybody was so worried about, myself included, was would we see the hospitals overwhelmed? Would we see all of this? And it doesn't look like it happened, or at least not yet anyway. Looks like we've managed to keep that curve underneath the capacity of the healthcare system, although barely in some cases. And so everybody's trying to analyze what's going on. Everybody's trying to figure out when to go back to work. Everybody's just in this space, and I hadn't realized until just now that that the second half of the curve, the downside of the curve, is worse than the front side because, number one, you've been at it for you've already been locked down for 3-4 weeks, and then now the numbers are getting smaller every day, and it's a question of when do you actually get back out there. So you never really know what's the cause and what's the effect. Is it the effect that's it seems like now we have an effect, and so we're trying to backtrack and figure out what the cause was. And I don't think anybody knows what the cause was. I don't know if anybody will be ever be able to know what the cause was. One of the things I have not talked about that's been a concern of mine from the beginning is that, and I was not really going to bring this up until we look like we're getting on the other side of this, but in the 1920 flu pandemic, there was a severe wave, came in the spring, came and went, affected a lot of people, but when it came back in the fall, it was the fall that was the killer. It was just far, far, far deadlier than what we saw in the spring. I haven't been too worried about that, and I haven't been talking about it too much because, number one, if that's the case, there's nothing I can do about it. But more importantly, the the difference between now and 100 years ago is that every day that goes by now is just, it just buys us time. It buys us time for therapies to work. It buys us time for us to do more, tests on this. Presumably, the people who were immune during the first wave, developed immunity during the first wave, had immunity for the second wave. They were able to come in hospitals and work there. There's it's just a time when everything is just turned into mush, and I see in some comment sections on other websites where it's a case of hysteria now. It's like I've seen people saying, if you don't have the guts to go out there, and I'm just tired of it. So we just we sit here. The only other thing I really was thinking about in the last time since we spoke is we were talking about the fact that not everybody needs to be held back in terms of returning at the same rate. We were talking about how would you know, would you need some kind of test positive and so on. And after a great deal of thought on this, I thought, the only way to do this, there's only one way to determine who's able to go back and who's not. And I've thought about it and thought about it and thought about it and thought about it. And the only way to determine that is for every individual person to determine it. That's the only way out of it. I think at this point, somewhere in this point, somebody should be saying, here are the 3 risk groups or the 5. If you're young and healthy and have no underlying health conditions, you're in group 1 as a definition now, not as a legal classification, just as a definition. If you're somewhat outside of that, but you don't have respiratory problems or severe medical cases, if you're over 60 but relatively healthy, whatever the case may be, you're in group 2. And if you're one of those people who has respiratory problems or underlying health, or you're over the age of 70 or 80 or whatever the number is, then you're probably in group 3. And I was concerned about how would you deal with cheaters on that, and how would you be able to show or prove that you had immunity. And I realized there's no way to do that where the cure is not worse than the disease. So I think you would just have to do it on your own. Everything that we've been doing, we've pretty much been doing on our own. People have been locked in their houses. I know some people who've been just simply haven't left their house in 3 weeks. Other people are out there all the time. When we drove in today and I saw people walking down the street, just small groups of people with no mask. I saw people riding bicycles by themselves with masks. And I just think that the only way to do this is just to basically make a decision for yourself, and then decide for yourself. But the entire idea of flattening the curve was to make sure that the healthcare system didn't get overwhelmed, that there wasn't that spike that poked through what we were able to deal with. And it's starting to look like, even in the worst case of New York City, that we managed to prevent that outcome. Or maybe the outcome was never going to happen. I don't know. Nobody knows right now. But whatever the explanation is, it's looking like New York has turned the corner on infections. Certainly it looks like Italy has, and so on. And so now we have to start asking questions about going back to work. And once again, We see Nancy Pelosi blocking relief for small business and individuals, and at the same time saying there's no way we can restart the economy now. And she's just putting down a marker so that whenever people do go back to work and people die after that point, she'll be able to pin it on the president. And that's the political class we have these days. We never would have survived World War II. We never would have survived anything with this political class. Would have been, if we'd had to face World War II with the press corps we have and the opposition, the political opposition we have, we should have just surrendered in advance and gotten it over with. Every day that goes by, these people continue to defy my belief, let alone my expectations. So we're just going to have to do it on our own. And I think that's basically it. I think we just have to do it on our own. I had a chance to talk to just a very small group of members at BillWhittle.com yesterday. I set up a video conference. We decided to do it through Zoom since we wanted the Chinese Communist Party to hear everything that we were saying. What I found was that people in different risk groups were taking their own risks accordingly, and that just seems to be about the only way to do it. I think the governor of Michigan is shutting down. I don't know. I mean, this whole thing is going to be a test of not so much a test, just a revelation, just kind of a stark, they used to call it a fire assay, when you would have ore from a mine and you didn't know how much gold was in it. A lot of times you had to put it in the fire, you had to melt it to find out what was in it, you had to burn it to see what the amount of of actual pure metal in there versus slag was. And I feel like that's what this is doing. And there's a lot of gold out there, and there's a lot of slag too. And it's just beginning to get clearer and clearer and clearer. But I've always felt that this whole Democratic Party idea of betting on death, because that's what it is, was going to backfire. And already you're hearing stories now. Now the history is being rewritten to say that Trump artificially inflated the numbers so that he could take a victory lap when they were lower than that. And there's nothing they won't do or say, ever. There's nothing they won't do or say. They will do or say anything. And that's the world we live in now, where our own worst enemy is our own press. And I can't bear it. I want to get back to work, and I think the only thing positive you can say is that if we had not put these things in place, this gigantic wave would have come through. I have no doubt about that. I have no doubt in my mind that there would be tens or more likely hundreds of thousands of people dead now that wouldn't be dead otherwise if we hadn't done this. I'm 100% convinced of that. But everything stopped pretty much at once, and now the main thing, believe it or not, is to make sure that we don't all go back at the same time. Because if we do go back out there, we are going to go back out there. What we want to do is we want to go back out there in such a way that as you get out into the world and the risk increases again, and the some of those blocks on infection are reduced, then people are going to get sick again. And you don't want to basically take everybody, lock them up, keep them 100% hermetically sealed. The people out there who have already been infected get infected, and then they recover or they don't. And then basically you just release this entire swarm of people just to go out there and have the whole thing happen again. Ideally, you'd want to do sort of a gradual easing of this so that the people who had not been infected go back out into the world, and the social contact increases to some degree, and people are going to get sick. And the main thing is, I don't think anybody ever, look, the whole idea of flattening the curve was not so much to prevent infection. The whole thing was basically to to spread the infection out over time, and keep it underneath the means of the healthcare system. We've done that tremendously successfully here, and California is pretty much a flat line in terms of growth. We just haven't seen it, and I suspect that we're going to have another couple months of I don't want to call it grace exactly, but I think we're going to have another 3, 4, 5, 6 months of time. And I think we're going to have to be careful in the fall, but I think in the fall we'll be a lot more prepared for this. Somebody just said that they wanted to know if the governor or California put in place a law about not being out in public without face masks. I don't know if there's a law or not, but I'll tell you this: in the space of 4 days, 5 days, I saw 1 in 10 people wearing masks to 9 in 10 people wearing masks. And I think the masks and the gloves are going to be with us for a while. And that's actually kind of good from a epidemiological point of view. You basically release people kind of you let them self-release based on their own estimation of how healthy they are, what kind of risk they're in. And then over time, just the social habits will just start to take place. If people start seeing that, a month from now they've been out there and there's more and more, but there's more people on the road every day. It looks to me anyway. And so I think what's basically going to happen is people are just going to slowly get out there and they're going to judge their own risk based by what they're seeing. But if it turns out that we're past the peak of this first wave, and it certainly seems to be the case, then I don't, the healthiest people, the ones that are most likely to not develop serious symptoms. This disease has got a strange kind of a medical effect on people. There's the antibody response is weird. The whole business about very young people virtually immune to it is odd, and the immune response and the seems to be a little different for this. I am concerned in a way I wasn't just a few days ago that some of these cases of reinfection, now there's a small base, it may be that that the reinfection thing isn't really happening, or that it was a bad test set or a couple of bad test sets. But given the nature of this virus, if it is in fact assembled the way it appears to be based on the documentary I talked about, if it isn't in fact a virus that was created in a lab, I have a real problem with the idea that this thing may have had sequences put into it so that it could basically hide inside the body, in the way that HIV does, and chickenpox too. So I don't know yet. All I know is that time is every day that goes by is to our advantage. That there are something like 17 or something vaccines that are out there right now in competition, and that's the kind of competition you want to have. Everybody's racing to get it. The number of people seem to be turning up with lower antibody counts than you would expect after recovering from a disease. I wonder if that's true. I wonder if it's a bad data. I wonder if it's a rumor. And I also wonder if it's not a result of how this virus may have been put together. I don't know. I just know right now it's not just a question of being bored. It's a question of when the future's on hold, you don't have any sense of anything. And the worst of it is we don't know. We don't know if somebody were to say, hey, May 22nd, or something, but we just don't know. But I'll tell you one thing, it's not going to be a whole lot longer. People in this country, at least I know there are people watching this around the world and around the country, and there are some people out there that are not in any kind of a, they're not under any kind of restrictions really in motion at all. But here in California, everybody is wearing masks, and they seem to be doing it more or less voluntarily. I don't know. that mask thing happened overnight. It was just like bammo, no masks. Now everybody's got a mask, and and I think it's just a question of we're learning as we're going. Um, yeah, yeah. Dr. Fauci said we may never shake hands again. Well, this is why he's a scientist and not a politician, because that's just not going to happen, and I don't want it to happen. And furthermore, if it does happen, for whatever reason, there's this idea that we're going to go out into this sanitized world, and from now on, we're going to do nothing but sanitize our hands every 3 minutes, and we're all going to wear masks, and we're all going to, do fist bumps, or even if that were to occur, all it would do is make you much more likely to be killed the next time any kind of a disease comes around. We shouldn't be working on weakening people's immune systems. We should be working on strengthening them. You know, we really this idea that hey, we just the thing is we got to sanitize everything from now on. That's how people develop. That's why kids in the city have so many more allergies than kids in the country. They live in these sanitized environments. Their body doesn't know what a pathogen is, starts attacking itself, and they have these horrible allergic reactions. The number of people that die from eating peanuts seems to have gone through the ceiling. Maybe it's just reporting, but I don't remember any of that growing up when I was a kid. No, you can't have a peanut on the airplane because if somebody opens a bag of peanuts, some guy 17 rows behind you is just going to keel over. I don't remember that. And this whole thing about keeping from now on we're going to have to wear masks and gloves, and we're never going to shake hands again. Even if that were to happen, it would do nothing but make us physically weaker. And I just think that's nuts. Helio says in the country we say rub some dirt on it. Absolutely. There's nothing you can do that's better for your kids than to go out and let them play in the dirt all day. That's just it. And that's, I know this is true because we did. And after we fall off our bike with a skinned knee, we'd get in the mud and do what boys did in mud, just wrestle around and play soldiers and make mud cakes and all the rest of it. And you couldn't bring us down. We were just bulletproof. And I feel like I never lost that kind of bulletproof immunity. And George Carlin has a bit about that. It's a profanity laced, but it's hilarious. He says when he was a kid, he was growing up and swimming in the river, might have been the Hudson. And he said there was just like open sewage being discharged in the river, and he said that's what they grew up swimming in. And he said his immune system is like a special forces squad, and anything that gets in there is just going to be gunned down immediately. Anyway, I don't know what the outcome of all this will be. Nobody does. I just had I'd always known that this was going to get tiresome, and it never really occurred to me that the worst thing that could really happen in terms of people's attitudes, not in terms of outcome, but attitudes, is that when things are getting better, it's harder and harder and harder to do the things that we had to do when things were getting worse and worse and worse. But there's no arguing with the fact that things getting better is things getting better, and I suppose that's something for us to be grateful for. I don't have anything new to say today. I really don't. And if I have any new figures or data, I will bring them tomorrow. But otherwise, I guess that's really about it. I imagine a lot of you in the same situation I'm in. And just sick and tired of waiting for things, just waiting. Let's just get out of this, If we've passed the peak and now you can start releasing Americans back into the wild, then as long as they all don't go out in one single flood, then I imagine the people who will get infected will get infected. But as long as we have the means of dealing with them and the healthcare system is not overwhelmed and people with heart attacks are not dying in line outside of emergency rooms that are just, choked full of COVID-19 cases, then I guess we'll be about as well as we can be. Every time I hear a date on a therapy or anything, anytime I hear somebody say we've got this experimental therapy, we might be able to test it in 3 or 4 months, they end up testing it in 3 or 4 days. We've been told from the beginning probably a year to 18 months for a vaccine, then, well, maybe 10 months. Then yesterday I heard 4. And I suspect that we will start to see vaccines in the next month or so. Things are happening very quickly, and that's certainly good news. But anyway, I guess everybody has a right to be just tired and bummed out, and it's not even bummed out. I'm past bummed out. I'm just people say, "Oh, you should get home." I'm not trying to mock you. I appreciate the kind words. You get some more rest. It's like I don't need more rest. I've got plenty of rest. I don't want any more rest. Uh, I want to get moving. Um, and I know a lot of people must feel the same way too. So I decided to come in and talk about that. And if it turns out that you are feeling the same way, you're not alone. Anyway, yeah, Tom Bombadil has got it exactly right. The more rest I have, the more tired I am. That's exactly how I feel. That's it. That's it in a nutshell. That needs to be a T-shirt, Tom. You can make $1 billion with that right now. Yeah, the more rest I feel, the more tired I am, or whatever. A couple of people mentioned they liked the new Cold War episode. I liked it very much too. It was a great chance to talk about Robin Olds and Operation Bolo. So if you haven't seen that yet, it's called Out of the Jaws of Defeat. And that's at Esoteric Radio Theater on podcasts, and they've also got it on YouTube. So that's my second favorite episode, the one that's up there now, I think. I am working on episode 13. I couldn't get it done in 12. I'm trying to get 13 done, and I just can't seem to pull this carcass over the line. I mean, it's just, you know, it's the last episode, and there's just, how could you not talk about this? And then it's like, my God, it just keeps going and going and going and going and going. So, anyway, there's 13 episodes, so there's one after this one, and then there's a final one. I just couldn't get it done in there. But if you don't know anything about Robin Olds, I listened to that episode this morning, and I haven't listened to many of them, but I listened to that one. I liked it a lot. I thought it was really fun. All right, well, that'll do it for this edition of the CoronaSphere Lounge. Thank you very much to the members at BillWhittle.com who make this possible. And I think at this point, until we start getting news, I think maybe I'll just back it off on the weekends anyway. I'll try and do it every day during the week. But if we don't have anything to report tomorrow, I don't entirely know that it does much good for me to just come in and just sit here and say I got nothing to say. So I think most of the information, most of the discussion about treatments and therapies kind of happens in upside of the curve. So maybe we'll just do it on weekdays or something. I don't know. We'll see. But if there's anything to talk about tomorrow, I'll be there. And if not, I won't. I'll try to put a message up on Facebook one way or another. We'll see. Anyway, that'll do it. Thanks for joining us today. And imagine we'll see you probably Monday right here on the CoronaSphere Lounge.